Hello and thanks for watching. Let's get going and talk about rodent surgical guidelines. We will cover many different important topics during this presentation. We will talk about the importance of a trained surgeon, equipment and supplies needed for surgery, pre-op consideration, surgical area, anesthesia and analgesia, experimentation, animal and surgeon prep, Osted's principles, other important factors, wound closure, recovery, and post-procedure care. Let's start with the importance of a trained surgeon. Training is important because we want our animals to have an optimal recovery with less physiological responses. In return, your experimental results are also going to be much better. Also, if your institution is ALAC accredited, it must comply with what is written in the guide. And in the guide, it is actually stated, personnel conducting surgical procedures must have appropriate training to ensure that good surgical technique is practiced. That is asepsis, gentle tissue handling, minimal dissection of tissue, appropriate use of instruments, effective hemostasis, and correct use of suture material and patterns. Now let's talk about equipment and supplies. This list of equipment is a must for surgery. A microscope will help you in performing an atraumatic surgery and will support ergonomic posture. You need good illumination source, your anesthesia system, an autoclave, of course, to sterilize your instruments, hot bead sterilizer, to sterilize your instrument in between the surgeries. You also need some heat sources to supplement your animals with heat throughout the procedure, a scale, a shaver, and of course some good surgical instruments. Now for the consumable supplies. Catheters and vascular access buttons, flush and lock solutions, surgical drape, surgical gloves, syringes and needles, silk and suture material, swabs and gauze, and all of these, of course, are all sterile. You also will need some alcohol and some surgical antiseptic, such as chlorhexidine, for your scrub. Now let's talk about some factors to consider prior to surgery. If the animals are coming from another facility, it's always a good idea to let them acclimate to their new environment for a few days prior to doing the surgeries. They need to unwind from that stress of transit and adapt to everything new at their new facility. Animals should also be free of clinical signs of disease and anomalies, and usually rodents are not fasted prior to surgery as they cannot vomit and have a very high metabolism. The age, size, and strain should also be considered. For example, the weight requirement, especially in mice, is much needed for a successful surgery. Next is the surgical area. Ideally, the three surgical main functions, which are animal prep, surgery, and recovery, would be physically separated. You would have a room to prep the animals, one for the surgery, and another quiet and maybe warmer room also for the recovery. Well, unfortunately, most people do not have access to this perfect scenario and have to work in a space that was not originally designed for surgery. If you are in that situation, make sure that the three functions are at least separated by a few feet, or even better, on separated surfaces. In any case, the surgery space should be dedicated to the surgeries only while they are being performed. It should be away from foot traffic, should be quiet and well lit, clean and uncluttered with easily sanitized surfaces, and surgeries should not be performed in an animal room. Wherever the surgery space in the surgical area is located, the preparation of a sterile field is needed. Should prepare your sterile field by disinfecting the area where the surgeries are going to be performed. Then you should use drapes to cover the surgical area, and of course you will also use a drape later to cover your animal. You should put on sterile surgical gloves. Place your sterile instruments and other sterile supplies such as your suture on your sterile surgical drape. And any equipment that will be touched during the surgery should be covered by a sterile material. Now let's chat about anesthesia. The best general anesthesia you can use is the inhalant anesthesia. There are even now some new technology specifically designed for inhalant anesthesia in rodents. If you do not have an anesthetic machine, well, different types of injectable in conjunction with other agents can be used. What are the 4 stages of anesthesia? The first stage is called the stage of voluntary movement. It's from the administration of anesthetic to the loss of consciousness. Stage 2 is involuntary movement, with the loss of voluntary control and your CNS depresses. Stage 3 is your stage of surgical anesthesia, and it's actually divided in 4 planes. First plane is light, where the eyeball movement ceases. Plane 2 is medium. It's actually your plane of surgical anesthesia, and that's when the pedal reflex is absent, also when you do a toe pinch and make sure there's no reaction from your animals. Then you have plane 3, which is medium deep surgical anesthesia, and that's the beauty of when you have a inhalant anesthetic, that you can reduce the concentration, and then your animal goes back into that plane 2, medium. Plane 4 is very deep overdose. That's when the sphincter control is lost, and then stage 4 is death. It is critical to monitor the anesthesia depth throughout the procedure. We do not want to perform surgeries if our animals are not in the right surgical stage and plane. There are some physiological monitoring systems out there that will monitor your core vital signs such as heart rate and pulse oximetry. If not, you can always use the traditional methods. We already talked about the toe pinch, so that's definitely one of them. You also always want to observe the respiratory pattern and frequency. A shallow rapid breathing indicates a light anesthesia, while a slow and labored one indicates a deep anesthesia. Keep an eye on the color of the mucous membrane, muscle relaxation, and reaction to surgical manipulation. Another important topic is analgesia. The use of analgesics is required for survival rodent surgery and will be driven by your veterinarian. Preemptive analgesia, which is initiated prior to surgery, will help in preventing pain and optimizing post-op well-being. It will also enhance intraoperative stability, and if you give opioids prior to surgery, they will also reduce the gas anesthetic consumption. Multimodal analgesia is the use of different classes of analgesics to target the different receptors. We will look at the different classes of analgesics in the next slide. There are 5 different classes of analgesics. The first one is opioids, such as buprenorphine and fentanyl. We all know that these are controlled substances, and they are good for moderate to severe pain. The second one, which are the NSAIDs, the non-steroidal and anti-inflammatory drugs such as carprofen and meloxicam. They're good for mild to moderate pain and inflammation. There's also the local anesthetics, such as bupivacaine, and the alpha-2 agonists such as xylazine, and then all the others in the last category. Now let's cover heat supplementation. Since rodents have a high body surface area to volume ratio, their body temperature drops quickly. Not to mention, of course, that they are shaped for surgery, which makes matters worse. For a successful recovery, it's critical to provide supplemental heat during the pre, intra, and post-operative phases. We want to prevent hypothermia, as it decreases heart and respiratory rates as well as blood pressure, also delays wound healing, increases the risk of wound infections, it prolongs anesthetic drugs action and recovery, and can lead to death. So all good reasons here that we want to prevent hypothermia. So how to prevent hypothermia? There are many ways. The first one is by supplementing heat with external heat sources, such as temperature controlled electric pads or water blankets. By avoiding direct air current blowing on the animals. By removing the appropriate amount of fur during animal prep, don't remove too much to promote heat loss. By using warm alcohol antiseptic for skin prep and warm saline for the sub-Q injection. And by minimizing surgical time and providing nesting material at recovery. Our next topic is animal prep. Prepare the animals for surgery. You want to administer the analgesia if done preemptively, and remove the fur. When you shave, always visualize where the incision is going to be and remove the fur from an area that is centered over the incision site. Remove enough fur to prevent contamination, but don't remove too much to promote heat loss. And use caution with shavers. You can remove the loose fur with a dry gauze, works really well. And you want to apply a ophthalmic ointment to prevent the cornea from drying. The surgical scrub may differ from different institutions, but at a minimum, the shaved area is disinfected with 70% alcohol and a surgical antiseptic such as chlorhexidine, and with a minimum of 2 applications of each. The application must start at the center of that shaved area where the incision is going to be and work towards the periphery. For optimal efficacy, surgical antiseptic should stay on skin for about 10 minutes. Now is the surgeon preparation. You should prepare yourself for surgery by doing a good hand scrub and wearing the required attire. A clean lab coat, gown or scrubs, your surgical mask, surgical cap, and sterile surgical gloves. Remember, it's important to don the gloves properly with an open or closed gloving technique. Now let's go over the Halsted principles. First of all, who is William Halsted? Born in 1852, he was an American surgeon who emphasized strict aseptic technique. He was chief of surgeries at Johns Hopkins, and he established the first surgical training program in the U.S. He introduced many new surgical procedures, including radical mastectomy for breast cancer. He also introduced rubber gloves for surgery. His principles should be followed for lab animal surgeries. The 7 principles to apply when performing surgeries are: observe strict asepsis, handle tissues gently, control hemorrhage, preserve blood supply, minimize tissue tension, appose tissues accurately, and eliminate dead space. We will go over these in detail in the next slides. What is aseptic technique? Aseptic technique is the use of specific procedures to reduce microbial contamination to the lowest possible practical level. It is required for survival surgery. It will reduce the risk of infection and promote animal recovery and welfare, and in return also good experimental results. It also increases catheter patency duration because it will reduce the likelihood of biofilm formation at the catheter tip. The gentleman that you can see on the picture is Joseph Lister, who was a pioneer of antiseptic surgery. To follow strict aseptic technique, a sterile field must be created. Sterile instruments, supplies, implantable, and wound closure materials should always be used. Sterile surgical gloves should also be worn. And the sterile drapes will serve as a place for your sterile instruments and supplies, and also to provide a barrier over the animal. The sterile drape also prevents contamination of the suture. To help maintaining asepsis during surgery, you can sterilize the tip of your instruments in between surgeries with a bead sterilizer. Also avoid touching anything non-sterile once you have your surgical gloves on. Use sterile material to manipulate anything that would be non-sterile, and if you do touch anything non-sterile, then you should change your gloves. The second principle is handle tissues gently. Surgery is gentle. It should be performed with as little trauma as possible. If the surgeries are atraumatic, then it will decrease, obviously, tissue trauma and inflammation, post-surgical pain and distress, and physiological responses, which in return will result in optimal wound healing, animal recovery and welfare, and animal models and experimental results. The next principle is control hemorrhage. Blood loss during surgery should be prevented as it increases the recovery time and the chance of death, and it also introduces research variables. There are many different ways to control blood loss, and just to name a few, you can apply direct pressure, you can use ligatures and clamps, and a cauterizer or a hemostat crush. The fourth and fifth principles are preserving blood supply and minimizing tissue tension. Preserving the blood supply will support wound healing, And also, for an optimal wound healing, minimizing tissue tension is critical. If excessive tension is used when you suture, it will interfere with blood supply and may result in tissue necrosis. As part of the normal healing process, tissues need room to swell. Sutures that are too tight will actually strangulate the tissues and impede wound healing. The next one is appose tissues accurately. When closing a wound, the edges of an incision can be apposed, inverted, or overlapped. Apposed, you will have the optimal wound healing, as the incision, the edges are touching, and that will yield optimal wound healing. Everted is also good. It's like when you would actually apply a wound clip and then they fall back a little bit, but you have the edges everted. You also have, again, a good wound healing. But if the edges are inverted or overlap, the incision will definitely not heal properly. What is also crucial for optimal wound healing is proper suture placement, suture material size, and pattern. And we'll talk about suture later in the presentation. The last principle is eliminate dead space. Dead space is eliminated by closing properly each layer of tissues. By doing so, it reduces the risk of seroma formation. And seroma, you want to prevent seroma formation because it will impact wound healing and promote bacterial infection. Now let's cover some other important factors. The first factor I want to mention is keep tissues moist. You should keep hydrating the tissues during the surgeries so that they do not get dry. Second one is time is trauma. Minimize your surgical time, but definitely do not rush, right? At one point, you will get quality and speed to plateau, and that's when it is ideal. Next one is skin incision location. I always say it's the first step to a successful surgery. If your location is off, then during the surgery that can mean more trauma to the animal. The last one is incision size. Especially when you're a beginner, trying to make an incision that is too small will also lead to more trauma later on. So it's okay to do the incision a little larger, and as you get more experience, it will actually get back to a smaller size. Also, since the incision heals side to side, it doesn't matter that much if your incision is a little larger. Okay, now we will cover wound closure. For closing the wound on the abdominal wall or subcutaneous tissue, absorbable suture should be used. And the size 5 or 6 works great on rats and mice. Anything larger is just really too big. For the skin, it can be closed different ways. You can use non-absorbable suture, same size, 5 or 6/0. Wound clips work also really good. Tissue adhesive or some combination also of the above. Let's go over a few suture facts. The suture sizes go from 7 to 11/0, size 7 being the strongest and the biggest, and size 11/0 the weakest and finest. Remember that suture materials are foreign bodies in the wound and they can lead to the development of infections. Therefore, use the least reactive suture of the smallest size and the fewest number of sutures to give you a proper wound closure. Let's go over proper suture application. The first thing is to restore the alignment of tissues. Then, as we previously discussed, you want to oppose the incision edges for optimal wound healing. There are different knot options to close a wound with. You can use a surgeon's knot or a double knots, but make sure the tension is avoided and the sutures are not too tight. But knot security and also preventing slippage is important, as loose suture may become undone. Usually the first knot's a little slack, and the ones on top are tighter to secure your final knot. Cut the strands the correct length. Do not leave them too long, especially if they're left sub-Q or internally. And do not forget to maintain a good aseptic technique. Let's just quickly go through some of the suture patterns that are commonly used. The first one is simple interrupted. The simple interrupted, definitely widely used. I gotta say that's pretty much the suture pattern I use the most in my career. What's nice about the simple interrupted is that the tension is adjusted throughout the suture line, and if one of the suture breaks, it will not result in failure of the whole suture line. The simple continuous, exactly, if something happens and somewhere in there you have a breakage, then the whole suture line can open. However, this provides a very good seal, and that's why it's often used when closing the abdominal wall, for example. Then there is the subcuticular pattern, which is a buried suture. It opposes the incision edges very nicely, and it prevents chewing the suture line. There's also horizontal mattress. This one everts the wound edges, but gives a good wound acquisition and strength. So whatever, again, suture pattern is used, as long as you have a very good healing of the wound, it really doesn't matter at that point. Our next topic is recovery. The animal recovery should be supported by hydration. So a nice injection of a 1 ml of warm sterile saline after the surgery or even just prior to surgery will definitely help in their recovery. Put the mice in a clean environment in ventral or lateral recumbency. And we talked about heat supplementation, again, very critical for the recovery. You can always monitor also what's the temperature inside of the box and make sure it's the correct temperature. You should also monitor the animals until they are fully ambulatory before putting them back in the animal room. Giving them some palatable supplements also will really promote eating and weight gain. So there are some supplements out there ready to go for rodents, and it will really, again, help them in recovery. Provide some nesting housing material, that is a must. It will help in reducing the stress, thermoregulation. It provides a hiding, a safe place for them to go, and also a way of monitoring recovery. As you know that if, for example, your mouse is feeling well, they will build their nest. Also, if you can pick a location in the animal room where you are going to put the box after surgery, if you can pick a low lighting and quiet room environment, that is definitely also something that will be beneficial to them. Our last topic is post-procedure care. The animals should be observed usually for a minimum of 5 days after the surgery, and you want to look at their general appearance. You know what a healthy rodent looks like, right? So if it looks well, healthy, you know it's been eating and drinking and it's not dehydrated. However, if you see that they are dehydrated, give them some warm saline sub-Q. Look at a cage environment. If there are feces, you know your animal's been eating, but also have they built their nest like I just discussed? Are they showing any signs of pain and distress? If they do, giving additional analgesics and providing supplemental heat will also help. Always also consult with your veterinarian for more guidance. Then you should look at the incision site. How is the wound healing, right? Is it normal healing, or is it red and infected? You should also always document the observation. The observation should be on a cage card, should be in a book somewhere, and write your observation. Is the animal bar, bright, alert, responsive, and hydrated? Write the actions that are taken. If you gave more analgesia, write that down. Also date and initials so people can track of who did the observations. The wound closure material should also be removed, usually about 10 days post-op. In acknowledgement, the rodent surgery application of aseptic technique and perioperative care by Marcel Peregenty of the University of Texas. The course on microsurgery and experimental research techniques by René Lemy at the RRSSC, and the guide for the care and use of laboratory animals. So this concludes this presentation. Thanks for watching and have a wonderful day.